New York State has been the hardest hit in the country by the coronavirus, closing in on 12,000 cases and counting. Many of them centered in the New York metropolitan area, where this show and so many others broadcast from. Dr. Steve Corwin is the president and CEO of the New York Presbyterian Hospital System, which runs more than a dozen major hospitals in the greater New York City area. Dr. Corwin joins me now by Skype. Good evening, doctor.
Good evening, Janine. Thanks for having me on.
Well, thanks for joining us. You're at the epicenter in New York City. Do you have what you need for all of the hospitals? And let me just say one thing. I do want to give you some credit here. I looked this up today. In terms of New York State, New York Presbyterian Hospital, Columbia Cornell, #1. And in the nation, you are #5 in the nation, your hospital system. So having said all that, do you have what you need to continue to be #1 in New York?
Janine, let me just go back for a second. As you said at your beginning, we will get through this. It's going to be very tough, but the reality is that New York City's not going to break, and America's not going to break. We have the best healthcare system in the world, and we will get through this. Now, the president has unleashed all the manufacturing capacity for gloves, all the protective equipment, ventilators, et cetera, but it's going to be a little bit of time before that ramps up. And right now, our biggest need is for personal protective equipment for all of our employees. We're seeing we can predict the surge of this. We think that over the next 3 to 4 weeks, we will see the bulk of the surge for our hospital system in the city, certainly for my hospital system. We've done a lot of predictive modeling around this. And so the urgent need right now is for protective equipment. I know the governor is working on it with the president. And as you said before, this is not about politics. This is about America.
Well, and doctor, what we have up on the screen now are all the hospitals that you are the president of, and the Greater New York Hospital Association. But when you talk about the needs that you have, how many healthcare employees do you have in your system?
Well, we have 47,000 employees, and if you include the doctors from Columbia and Cornell, we're north of 60,000 employees.
And do you have? Go ahead.
Go ahead, Jeannie. I'm sorry.
Do you have gloves for the patients coming in? Do you have gloves for the healthcare workers?
We do, and we have masks. But let me give you an example. On an average day pre-coronavirus, we would use 4,000 masks a day. We're now using in excess of 45,000 masks a day, 10x. So when Mr. Navarro was talking about the strategic stockpile, that strategic stockpile, as we go forward, is going to need to increase dramatically to combat things like this.
All right. And you said something interesting. You said you've done some modeling around when this might peak. You know, it's interesting. I just heard from another guest that we're talking 3 or 4 months. You're talking 4 weeks?
Well, we think our predictive modeling for our hospital and the hospital system is about 4 weeks from now, middle of April. Remember, the rest of the country may be behind New York. We modeled out the Wuhan outbreak. We modeled out the Italian outbreak. We modeled out when the lockdowns occurred. And for us, it looks like April, middle of April, or thereabouts, that it will peak in New York City. Now, that doesn't mean it's not going to peak in other places at different times.
Right, right. And you believe in this shelter in place right now in New York State and New York City?
Look, you know, I give the president, the administration, the governors a lot of credit. This is a huge economic impact. You know that. And I think that Americans are really sacrificing to make sure that they can protect each other. And I think it's the only thing we can do right now, because we don't have a cure and we don't have a vaccine. There are medicines that are being tried, but we don't know whether they're going to work or not. And so this is the sanest thing to do.
All right. Dr. Steve Corwin, thanks so much for taking the time to be with us tonight. I know how busy you are.
Thanks for having me on. I really appreciate it. And thanks for all that you do.
Thank you. And the stock dump